stuff backwards and forwards, not only because we live it, but so many of us have had to do our own research. You know, I am heavily invested in PubMed and Google Scholar. I can read a paper. I send papers to my providers. We are experts from a lived experience, and because some of us are getting in there and doing the research ourselves. So that's why it's important to include us.
See that? I knew I would ask a brilliant question, and it was you, Senator Cassidy.
I defer to Senator Dr. Roger Marshall.
Well, thank you, Chairman and Ranking Member, again. And this is personal for me. One of my loved ones is one of those 16 million people that suffered from long COVID, incapacitated for some 2 years. People often ask me, well, what's long COVID? And I think that we have some loose definitions, but I tell people it's like if you had mono that never goes away. There's a brain fog, there's aches and pains, and sometimes the pains follow nerve tracks, the vagus nerve and the femoral nerve, and maybe it's a venous process and there's micro blood clots. Like you, we've taken my loved one to dozens of doctors. I've talked to 40, 50, 60, 80. I've read everything there is to read about long COVID. Talked to other members of the Senate that have had long COVID. What are they doing? So I share your frustration. I am frustrated that our CDC seems to be more focused on, I guess, vaccines than they are treatment for long COVID. I mean, simple questions still not have been answered. If you take Paxlovid early on, even though you're young and healthy, does it help decrease the incidence of long COVID? I don't think we know the answer to that. Do vaccines increase or decrease the incidence of long COVID? If you've already had COVID, does the vaccine increase or decrease your risk of long COVID? You know, we don't know the answers. So I couldn't be more frustrated that it's vaccines, 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 rather than focused on diagnosis and treatment. I don't need epidemiology anymore. I need diagnosis and treatment. What blood tests should we be ordering? What is the standard of care when a person has long COVID? What blood work should we be ordering? Now, I'm going to give you some hope, though. I think in the past month, I finally have talked to a couple physicians that get it, that understand it. Dr. Bob Redfield from the former CDC is one of those people that has dedicated his life now to figure out what's causing long COVID. I think they're getting closer, but I couldn't be more disappointed in what is coming out of the CDC right now, that they're not cooperating adequately enough with private doctors. Trust me, these doctors, we want to help. We want to help you, but we don't know, we don't have a cure for mono. We don't have cures for the flu. So I'm frustrated. And Mr. Chairman, what I'm really concerned about is more recent news coming from from foreign lands that just recently learned that Dr. Lily Wren, 2 weeks before we knew what COVID was over here with sequence, that our own NIH, that she had submitted the DNA sequence for COVID to our own NIH on December 28th, but the NIH deleted it. That would have given us 2 more weeks to work towards a vaccine and curing and preventing the problem. And then I find out she was on the EcoHealth grant from NIH, our own American dollar. She's working for the American government. She has the sequence, she gives it to us, and we delete it. Remember, it only took 2 days for Moderna to develop a vaccine. If we would have had the vaccine earlier, my point is, how many long COVIDs would we have prevented if we knew that this was person-to-person transmission, which the Chinese certainly did by then. If we would have known this was person-to-person transmission, that this came from a laboratory, that it was a superbug, maybe we could have prevented some of these 16 million people. It points out that we don't have a good grasp of our grants. So we award these grants, people are doing research, and we don't have a good grasp of what they're doing. And I'm even more concerned recently, again coming out of China, that their viral gain of function continues. This week they found they've made a COVID virus that attacks the brain more so than human lung cells and human veins. That's why we've called for a viral gain of function moratorium until we can wrap our arms around this this horrible situation. Who here can say the benefits of the virus that looks like COVID that attacks the brain more over any other cells? What are the benefits of that type of research? People just can't show me what the benefits that are. Well, I guess my question for you all, and I think it goes to the mental health of my patients, my family members, the people I talk to. If we knew where COVID came from and what are we doing to prevent it? And this time, is your daughter, your son, I'm sorry, that your daughter, you know, this is definitely a mental health impact on people as well. Are you frustrated with the CDC that we don't have better research out there, diagnosis, treatment? Are you frustrated that we're not doing more to stop this next round of COVID from coming?
I just want them to do something about it now going forward and to acknowledge that it's real and how it's affecting the children.
I get it. Thank you. Thank you so much, everybody.
Senator Murray?
Well, thank you very much, Chair Sanders. I'm really glad we're having this really important hearing, and I want to